This video series is for primary hyperparathyroidism. There are total 6 MCQs. Let's start the video. Question number 1 is, which of the following is false about primary hyperparathyroidism? Option A is male to female ratio is 1:3. Option B is most cases are sporadic in nature. Option C is hypercalcemia is seen. Option D is none of the above. Answer is D, none of the above. Primary hyperparathyroidism is an endocrine disorder where one or more parathyroid glands produce too much parathyroid hormone, causing high calcium levels in the blood and other health problems like kidney stones and bone thinning. Primary hyperparathyroidism affects women significantly more often than men, with a female to male ratio about 3:1 to 4:1. Primary hyperparathyroidism is usually sporadic, but 5 to 10% cases are inherited as a part of familial syndromes. Familial syndromes like man 1 syndrome, man 2 syndrome, man 4 syndrome, familial hypocalciuric hypercalcemia. These are some familial syndromes. Sporadic cases are most often caused by single parathyroid adenoma, while familial forms are linked to specific germline mutations in genes like man1 rat or calcium sensing receptors. Question number 2 is, which of the following clinical presentation is seen in primary hyperparathyroidism? Option A is abdominal groans. Option B is psychiatric moans. Option C is renal stones. Option D is all of the above. Answer is D, all of the above. Primary hyperparathyroidism symptoms are varied but commonly include fatigue, bone and joint pain, muscle weakness, memory loss or depression, and kidney problems such as kidney stones and excessive urination. Many people with this condition are now diagnosed through routine blood tests before experiencing noticeable symptoms. Common symptoms are musculoskeletal symptoms like bone pain, muscle weakness, fragility, increased risk of fractures. Mental symptoms are depression, forgetfulness, trouble concentrating, memory loss, and fatigue. These mental symptoms are due to hypercalcemia conditions. Gastrointestinal conditions like abdominal pain, loss of appetite, nausea, and constipation. Urinary complaints like frequent urination, increased thirst, kidney stones, or calcification. Question number 3 is, most common presentation of parathyroid gland in primary hyperparathyroidism. Option A, in most cases single adenoma is seen. Option B, in most cases all 4 gland hyperplasia is seen. Option C is both. Option D is none. Answer is A, single adenoma is seen. In primary hyperparathyroidism, the parathyroid gland overproduces parathyroid hormone, leading to hypercalcemia, while most cases present asymptomatically with mild hypercalcemia on routine screening. Classical signs include stones, bones, abdominal groans, and psychiatric moans. Causes of the presentation: parathyroid gland overactivity. One or more parathyroid glands become overactive, leading to excessive parathyroid hormone secretion. Parathyroid adenoma. This is the most common cause of primary hyperparathyroidism, accounting for about 90% of cases, is a single benign tumor in the parathyroid gland, that is parathyroid adenoma. Hyperplasia, less commonly, multiple glands can become enlarged and overactive. This is less common condition, but parathyroid adenoma is seen in 90% of cases. Question number 4, which of the following is not seen in primary hyperparathyroidism? Increased parathormone, increased serum calcium level, increased serum phosphate level. Option D, decreased serum phosphate level. Answer is increased serum phosphate level. In primary hyperparathyroidism, elevated serum calcium and inappropriately normal or elevated serum parathyroid hormone level and low serum phosphate levels are typical. This condition is caused by the overproduction of parathyroid hormone, which leads to increased calcium absorption and decreased phosphate resorption. Question number 5, which of the following is X-ray featured in primary hyperparathyroidism? Option A, salt and paper appearance in skull X-ray. Option B, subperiosteal bone resorption in distal phalanges. Option C, osteopenia. D, all of the above. Answer is D, all of the above. X-ray findings in primary hyperparathyroidism include subperiosteal bone resorption, especially in the heads, the classic salt and paper skull, osteopenia, and brown tumors bone cysts due to excessive bone resorption due to excessive secretion of parathormone. Question number 6, which of the following is not an indication of surgery in asymptomatic primary hyperparathyroidism? Option A is serum calcium 1 mg per deciliter above the upper limit of normal. Option B, creatine clearance less than 60 ml per minute. Option C, 24-hour urinary calcium more than 400 ml per day. Option D is 24-hour urinary calcium less than 400 ml per day. Answer is D, 24-hour urinary calcium less than 400 ml per day. Surgery for primary hyperparathyroidism is indicated by a combination of symptomatic disease, high serum calcium levels, low bone density or fractures, reduced kidney function or kidney stone formation, or the patient is under 50-year-olds. Patients with any of these criteria should undergo surgery, as is the only definitive treatment for the condition. Indications for surgery are: patient is having age less than 50 years, are good candidates for surgery. Calcium level is more than 1 milligram per deciliter of the is the upper limit of the normal range. Bone health, osteoporosis defined as T-score of less than 2.5 at the lumbar spine, hip or wrist. Evidence of vertical fracture. These are also conditions of indications for parathyroidectomy. If kidney is not functioning properly, like creatine clearance is below 60 ml per minute, it is also an indication. Or if calcium excretion is more than 400 milligram per 24 hours, this is also an indication. So two conditions in kidney, like creatine clearance less than 60 ml, urinary calcium excretion more than 400 milligram. In bone, if T score is less than 2.5 of lumbar spine, hip or wrist, or if evidence of vertebral fracture is present, or if serum calcium is 1 milligram per deciliter or more above the upper limit of normal range. These are indications for surgery.